Uh, Good morning or good afternoon to all of you. Actually, it's a good night to me. My name is Kisoo Park. So first of all, I'd like to thank and also WHO and Tina and all the colleagues for inviting me to this valuable webinar. Actually, today I'd like to just share my experience from MERS outbreak in 2015 and also this COVID-19 crisis. So today I'm going to just break down my talk into three parts. First, what I learned from the past MERS outbreak and what and how we are doing using those experience, and lastly, how to deal with this infodemic using the concept of everybody also know the R lot, the reproduction number, which shows how fast the virus can spread all across the globe. So since many of us already know about the MERS outbreak, I just briefly want to talk about what happened because it's so important for Korea response measure. So at that time, back in 2015, a man came from the Middle East on May 20th. So he was confirmed with MERS-Cov virus, which was so severe at the time here in Korea. And also, because of that, 186 confirmed cases and 38 people died. So the we say case fatality rate was 20%. So it was pretty hard. And even though there's no community infection at the time, people so panicked because lack of information, like the health authorities at the time had not provided a list of MERS affected hospital names for almost about 17 days. So the rumors and misinformation, maybe disinformation, spread out across the country, even way faster, in a more severe way, the virus itself. So which hit the Korean economy so badly. So this is all the numbers in 2015. As you can see, revenues and customers and tourists and those passengers numbers, those are totally falling down. And also now, as you can see, across the globe, all the stock market plunged, still in unrest. This is not only from the virus, also from the infodemic, the problem. So based on our experience, the government realized that risk communication or rumor management or infodemic management is so crucial to overcome the crisis. So let alone the improving the medical countermeasure capacity. So the Korean government set up two new things within the KCDC. The first one is Emergency Operating Center, and another one is Office of Communication, where actually I had served as a spokesperson until last June. So we developed and also the risk communication guidelines and all the networks, and try to build up and maintain the trust, which is so important for containing the virus itself, also the infodemic management. I always say trust is almost everything. So based on this, we found out actually how can we define the infodemic. It's so easy to spread like emerging infectious disease, since there's no specific treatments and or vaccine, which is always unknown to the public or expert. And it sounds very or looks plausible and easy to understand. So lots of people always try to, almost easy to be sneaked in. So it also contains a portion of fact, which makes people regard it as true as a whole. and also spreads way faster than the virus in this almost like a Wi-Fi world, connected world, especially here in Korea. And also the infodemics move faster than the responders, which means this information or rumors can just pop up and just spreading out so fast, while the health authorities have to be ready and gathering all the scientific evidence. It takes a lot of time. So that's why the responders always kind of a little bit later. And also it's more dangerous to the people, especially with health illiteracy. That's why it's a health education during the pre-crisis is so important. So this is kind of examples. It's still is happening here in Korea. One is, that's me. I was on TV almost every day, just checking out those stuff. So spraying salt water into mouth or gargling with salt water. Some people just believe they can kill or prevent the virus, but it is not true, as we already know. And number two, he was a kind of famous politician. So he said that the garlic or garlic boiled water can prevent coronavirus, but it's not. But actually, it is helpful for our health a little bit. But see, look at all the Korean people. We all eat garlic contained food or something, but we still have more than 10,000 confirmed cases. And also spraying the methanol inside the home for disinfection, it ends up with the mom and two kids being kind of hospitalized here in Korea. And this also other kind of epidemics here in Korea. And so let me tell you how Korea is responding to epidemics. So since the MERS outbreak, we Korea have experienced a great precious lesson, which means we have to, whether it's private or public, we have to put together as a whole for the sake of the greater good. We realize when we throw this MERS outbreak, so the Ministry of Health, and they briefing 2 times, English and also Korean version, and information dissemination, and also fact-checking news by, this is a state-run TV, we say Korean TV, KTV, every day. Also Korean commissions, communication commission, they check online portals, including the click bait sites, which is so sneaky. They try to make a lot of profit just by luring people. So, and also police department, they are doing their job. And also traditional media, they are actually kind of a little bit cynical, but now they are changing their kind of attitude. So they make a fact-checking program. And also Doctors Association, they present recommendation and advice on misleading medical news, and also fact-checking. And major search engines, they just cooperate with the health authorities, monitoring misinformation. And also, especially telecommunication companies, they try to make a lot of money by, getting out a lot of text messages. But nowadays, they cutting off spam text message containing, misinformation or disinformation or rumors. Those are the, kind of channel or responding measures here in Korea. And so finally, considering what I learned or what I mentioned, so I think we'd better set up some response measures in a more systematic manner, like we do to calculate the R-lot, which is very useful nowadays to contain the virus. And also, it's going to be a great tools to reduce to the R0, I say the infodemic R-lot. So since we have to, slow down the speed of infodemic, let alone the speed slow down the speed of the virus. So I suggest, as you can see, this is the kind of formula of the R lot of the virus, which is determined by mostly the probability of transmission, average number of contacts per time unit, and duration of infection is. So I just made my kind of concept of framework. Infodemic could be affected by audience vulnerability related to their health literacy, and also the disseminators, which means the traffic volume, and the plausibility of the misinformation or speed of health authorities' response with the science evidence. So in this regard, we have to address the infodemic in a more systematic and science-based kind of quantitative way. So this is all. And maybe if you have any questions, I just put my address and also where I am now and where I were before. And thank you. But here in Korea is almost very late at night, so I'm not sure I can make it through until the end of this session. So please bear with me.